We are thrilled to gather here today in the spirit of collaboration and knowledge sharing to address the latest advancements in sickle cell disease research and treatment. This symposium has become a hallmark event to enhance the lives of those affected by sickle cell disease.
Man, FSCDR is the conference I look forward to every single year.
It's a community impact, and that whole community needs to understand more about sickle cell disease.
I've learned so much, and I've gotten inspiration and encouragement.
It's about the people who care to make a difference, and not just any difference, but a lasting difference, and a difference that changes the trajectory of lives.
I absolutely love this conference. This is my second year being here. And I love this conference because out of all of the medical conferences that I attend throughout the year, this is the only one devoted specifically to sickle cell disease. That is a diamond in the rough. When you consider the impact that sickle cell disease has in the healthcare community, it's not something that's widely talked about. So to know that there is a conference dedicated specifically to sickle cell disease, that is leaps and bounds. And that's one of the main reasons that brought me here. And my experience so far has been awesome.
So far, the experience with this conference has been really exciting and innovative. My favorite panel was the one hosted by Ted Love, addressing whether or not Wall Street is interested in sickle cell disease. And I think it was very innovative and compelling to the community, because oftentimes we forget that Wall Street makes these financial decisions for us as well. And so it was a very informative and innovative panel.
I've gotten to network with other nurses who are also in the sickle cell disease space, doing research, teaching students, working directly with patients. And so this, as an early career scientist, is a really great opportunity for me to get to network. Like I said earlier, to kind of get to know some patients and hear their stories directly from them, which isn't something I have as much opportunity to do being at a university setting right now, and really just to come and learn more and exchange ideas. It's been awesome.
I've been wowed. I know a lot about sickle cell. I'm a pediatric hematologist, but every single time I come to this conference, I've learned so much. I've already written down so many names and things I want to watch again, hear from again, people I want to hopefully invite to speak to our people to kind of spread this message. So my experience has been wonderful. It's been really great.
This event helps to move the needle forward because it provides an avenue for research and research progress, and for people to learn that knowledge, especially for providers and clinicians to take that back to their clients and to their patients by inspiring the next generation of researchers to be dedicated to do sickle cell research in all specialties, not just in medicine.
This is a really great event if you're someone who might want to know more about sickle cell disease. Maybe you've met a patient, whether in the ED, inpatient, in the community setting, who has it, and you're just curious, what could I do to better support these patients on their journey to care for themselves and to really live their best possible lives. And so this is a really good opportunity to meet with other clinicians and scientists who have those same goals, but maybe more importantly to meet with the patients themselves and get to hear their voices about what their lives are like and what they're really looking for in their health care.
Even as a patient, to understand what's happening on the research level, sometimes we could feel like there's nothing happening. There's the same therapeutics, there's no movement in the medical industry for sickle cell. And then you come here and it's just booths and it's, conversations, presentations, and this is just one of a kind. If you can get here, enjoy it, network, and take it back home.
For me, that's the key takeaway, that there's a group of individuals that are willing to work together and work hard to be innovative to try to make this better.